the Spinal Truth Show, weekly podcast edition. I am your host, Dr. Caleb Slater, here with Chris, who has a whole bunch of GI issues.
What? Actually, I don't, but...
No GI issues?
No, I mean, I did have, I guess, technically the gallbladder issue at one point.
Yeah, I mean, that's not really what people mean.
Right now, everything fully functioning, perfectly functioning GI system.
Well, you should count yourself lucky.
I know, but not everyone is built like this.
So if you're following this channel or for long enough, you know that we're really spine focused here, spine centric. And why are we talking about GI issues? Well, a lot of people don't know that a spine issue can cause GI issues. And we've said this so many times on this podcast, on our TikTok channel, and we've had a lot of guests already on the show that were treated with this method. And they were diagnosed with ulcerative colitis or Crohn's or IBS, and the treatments weren't working, and they kept looking for other solutions. And once they treated what was actually the underlying problem, a spine issue, all of their symptoms got better. They were able to get off of steroids or biologics. They were able to eat foods that they haven't been able to eat in a while. They were able to drink. So if you want to hear their stories, you can look back at some of our previous interviews. We're on YouTube and Spotify for this podcast. But we also have 2 interviews coming up in the next week and the week after. One with ulcerative colitis, and the other one was diagnosed as Crohn's. Is that right?
That's correct.
So one was a 14-year-old boy diagnosed with Crohn's. The other one, a 50-year-old man diagnosed with ulcerative colitis, both treated by treating their spine. And that's what we're going to talk about today, but I just wanted to give you the listeners, hey, there are other podcasts that actually interview the patients, and there are 2 podcasts coming up that will interview patients.
Yeah, so it is good to hear their specific journey. But in this episode, we're going to kind of dive into the rationale, I assume. Yeah.
So Chris, you are a common person, is that right?
My mom said I wasn't. My mom said I was special, but
mom's like. All jokes aside, especially when it comes to healthcare, you know the average amount, I'd say, right?
Yeah.
Have you ever heard of a spine issue causing a GI issue?
No. When you say that out loud, it starts to give me
sounds
thoughts.
A little like holistic-y,
it's like
right?
chiropractic.
Yeah. I get that a lot. Yeah. I get that. Are you a chiropractor? You sound like a chiropractor.
I see the comments.
Yes. Well, but now you've been with us, about a year now, and now you're
it's almost a year and a half. But
almost a year and a half, and now you've seen patients coming in and out. What do you think now, seeing this, like firsthand?
Yeah. I mean, I think there's a distinction here that we probably should talk about because of the comments about, well, are you saying Crohn's doesn't exist? Are you saying this doesn't exist? Everything is from your spine? That's probably not the truth. The truth is there are people who have symptoms that get diagnosed as something like that, and when they treat it, it doesn't do anything.
Right.
And the underlying problem was always a spinal issue. And then when they treated that, it's magic how it starts to actually attack the symptoms they were dealing with, right?
Yeah, and yes, I'm not saying there isn't Crohn's. I'm not saying there isn't ulcerative colitis. However, I am saying that a lot of these GI issues are being mislabeled and misdiagnosed. I'd say 100%. It's on a pretty high percentage. I don't know the percentage. Obviously, you'd have to treat a lot more patients over different regions and ages and genders and whatever to be able to give you that. But I'd say for the people that come to see me that I've pre-screened, I'd say about 60% of them get significant or complete relief of their symptoms.
Yeah. And the real eye-opening thing for me is seeing that people who have been dealing with these issues, how willing they are to go on these extreme medications or possibly surgeries, when what we are asking is, let's just check the spine, let's have you do a few movements to see if it affects the way your symptoms are. If it affects your symptoms, it offers you relief. Something that's completely non-invasive, not harmful in any way to your body. But that's where the pushback seems to come as well.
Oh yeah, people are, you're dangerous.
It's dangerous. And they were just asking you to literally bend over a little bit.
So what I would say, what I want, is that when you first start having symptoms, and this is a lot of symptoms, a lot of pain in your body, you go to the doctor and they look at that area, but then they also look at the correlating area of your spine. And if they can find anything at the spine, attempt treating it for 2 to 3 weeks, maybe 4 weeks. If you see a big difference in the other area, great, you know the underlying cause. If you don't, now you have the treatments. Now you have the meniscus, meniscectomy to your knee. Now you have the steroids and the biologics for your Crohn's or ulcerative colitis, right? Like, for a lot of people out there, it would be a better process and likely prevent them from having a lot of unnecessary medical treatment expenditures and stuff like that.
Well, I think it makes sense because when you're treating someone, you would think you would want to start with the least invasive form of treatment or the least form of treatment that could potentially have harmful side effects, right?
Sure, that's what you should.
And so the fact that is not even most of the time considered, that's potentially very harmful for a lot of people.
Yeah.
Because they might, like a lot of these people might not actually have Crohn's, they just have some back problems and...
Well, and you've heard them talk about their symptoms, right? Like, this is stuff I never thought of. I personally haven't had any GI issues.
Yeah.
But you get patients that they're in here talking, I go 8 to 12 times in the morning.
Yeah.
I have to work from home because I have to be close to a personal private bathroom, right?
Yeah.
I can't go on trips or road trips or I can't go out to the movies because it's probably more so the embarrassment of having to go to the bathroom 2 to 3 times or being worried about having an accident or not wanting to eat this food because then you're in, pretty debilitating pain for the rest of the night, the next day, maybe a few days.
Yeah. And I think there's an element to this whole thing is a societal change that has occurred over the last 20 or so years insofar as we are now, our lifestyles are so much different.
Yeah.
We sit so much at a computer. We bend over so much at our phones. We are in this position that the majority of us don't ever undo. And so I think there's like a short-sighted look at a lot of these things because it's like, well, we can't see that like this difference in society may have had an impact on some of these diagnoses.
I think
symptoms.
it did.
Do you know what I mean?
Yeah, I think it did. And to speak to that, so where in your spine can cause problems to your GI? It's actually a large area of your spine. It's from like T2 to about L2. So, right around we'll call it the collarbone area, all the way down to about the belly button area. Primarily, though, the belly button area, the TL junction, that's the area that has the stronger innervations to the GI system, and that tends to be the area where a lot of these patients have a problem. And to speak to your point, that sitting puts a lot of pressure specifically on that area. It's a pivot point of our spine. It goes from one curvature to another. So if you think about it like a coil or a spring, there is a part of that coil or spring that'll take up more force under compression. That's that spot.
So then I go and I ask you this. Why? Well, my doctor diagnosed me with Crohn's. So what is the test that they give you to tell you have?
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference. That's a good question. And so the short answer is there is no test for Crohn's. There is no test that you can take or a group of tests that you can take that will definitively say you have Crohn's. So they'll do blood draws and they'll look for certain markers and biological markers and they'll look for inflammatory levels and stuff like that. But all that does is show inflammation. They'll do MRI or CT scans, same thing, they can really only see inflammation. They'll do a biopsy during like a colonoscopy, same thing, they're testing for like cytokines, they're testing for inflammatory markers, but nothing says you have Crohn's. You can have a genetic predisposition, but that doesn't mean you have Crohn's. That doesn't guarantee you'll have it. That doesn't mean if you have it, it's because of that genetic predisposition.
So can a irritated nerve cause inflammation?
Yeah. So the way I describe it, so your nerves basically control everything in your body. They control your heart rate, they control your breathing, they control your muscle contraction, they control your bodily functions, of blood moving, right? Your nerves go to your intestines, smooth muscle. So these muscles need to contract to do their job. Their job is to move waste and help with nutrient exchange, get blood flow exchange, nutrient exchange, right? The way they do that is through contraction. If your nerve signal's not quite getting there, not as strongly, kind of like, picture it like your internet kind of going in and out, and you're trying to download something, how frustrating it would be. Kind of the same thing here. Those smooth muscle isn't contracting, waste is sitting there now. Okay, so now the waste is sitting there. Now you're not getting as much nutrient exchange. Now you're getting not as much muscle contraction, so blood flow is not as much. That waste sitting there breeds bacteria. Okay, the muscle's not contracting, not promoting blood flow, breeds tissue change. Okay, so now the tissue isn't as competent. It's not the wrong word, but it's not the word I'm looking for. It's it's not as pliable. It's not as healthy. So now it's more prone to damage. Muscles not contracting will lead to local inflammation in the area. Your body not absorbing the nutrients will lead to inflammation in that area. Your body not processing that waste will lead to possibly an infection. Like a lot of people will get SIBO, small intestinal bacterial overgrowth, and the large reason is because the waste is just sitting there too long.
So these sound like things that don't just occur overnight.
Right, and for a lot of people with chronic problems, let's say chronic back pain, or chronic nerve issue, it's a slow development over time, and the problem is that your symptoms continue to evolve. Initially, you, let's say, twisted wrong and your back hurt, and then you rested for 2 to 3 days, 2 to 3 weeks, and you're like, now my symptoms are better. But often they don't actually get fully better, they're still there. And now over time, you dealt with some back pain for a while, but now it's not your back pain anymore. Now it's more your hip, your groin, right? And you forgot about your back pain because your back hasn't really hurt in a while. So now you go and you're doing stretches to your hip and you're strengthening your hip, or you're going to the doctor and they're MRIing or looking at your hip. And maybe that gets better or maybe it doesn't, but then at a certain point it'll progress and maybe it goes down your leg. Maybe eventually you get diagnosed with plantar fasciitis, or maybe the next symptoms are GI symptoms. And again, you're not correlating the back pain that you used to have to these problems. That you're not correlating them together. You're thinking of them all separate and random.
Well, and that's probably because typically we treat things with a tunnel vision.
Right.
My foot pain can only come from my foot, which is not true, right?
Yeah, I mean, so again, the way I would treat foot pain is we look at your foot, we ask you questions about your foot, but then before we actually treat your problem, we look at the correlating area of your spine and we see if that could be the cause of your pain, the cause of your weakness, the cause of your numbness or tingling, right? Same thing with the GI, is that you have to look at this area to see if there could be an underlying cause. And I don't want to say nobody, but I mean, it's like damn close to nobody does this. Yeah. Nobody looks for this. And if they do, they look at it the way the typical medical system does, is through imaging, which we talk about this a lot. Imaging's more misleading and inaccurate than most people realize.
Okay, so that's all about Crohn's. What's ulcerative colitis then?
They have a lot of similar symptoms.
Okay.
I've had a lot of patients, actually the one that we're interviewing in 2 weeks, or the show that's coming out in 2 weeks, he was originally diagnosed with Crohn's and then got switched to ulcerative colitis.
Okay.
So they have a little bit different of symptoms, but I'd say the large majority is an overlap. So and that's a problem, right? Where you have two different diagnoses, but the symptoms are very, very similar.
What about the treatments?
Treatments are almost exactly the same.
And so what is the typical treatment for something like Crohn's or ulcerative colitis?
Normally, so it's primarily medication-based. Most patients have tried some form of diet change first, right?
Yeah, I remember this patient.
Almost every patient, and almost every patient has gone through a few iterations of diet changes. They've gone to, and from extreme ends too, like carnivore diet to strictly vegetarian or vegan, to elimination diets, like low FODMAP diet is a big one.
Which, honestly, this is another eye-opening thing for me in hearing this upcoming interview, was talking about diet, because he did all that stuff. Constantly shifting his diet, trying to find something that would work for his Crohn's or his ulcerative colitis.
I would say almost every single one of my GI patients has gone through at least 2 to 3 different diets.
But what was cool to hear was after working with you and stuff, now he just eats whatever the hell he wants. And it doesn't affect
that.
him.
That to me is honestly one of the coolest parts of it, is this. I've had so many people, and the weird thing is that it's always different. Some people, the trigger is alcohol. Some people it's fried foods. Some people it's certain vegetables. Some people it's cheese. Some people it's marinara sauce. Some people it's eggs. Do you remember what he said? His was a little different too.
I think it was cheese.
Was it cheese? Oh yeah, you're right. Because then he talked about like goat cheese or something like that. Yeah. So everybody's a little bit different, but everybody has something or groups of something that will just trigger them. And after a few weeks of doing this, they're feeling better. They'll give it a try, and all of a sudden they're not getting that recourse. And you're like these are people that were maybe thinking they had allergies or they had a gluten intolerance or celiac disease or something. And no, it was just that your system, going back to that intestines that I'm talking about, where they're not contracting, where waste is sitting, where blood flow, nutrients isn't exchanging. Yeah, anything that might tip the scales a little too much is going to piss you off a lot, going to give you a lot more symptoms than if your body was healthy and you were able to properly absorb and digest.
Right. We've been talking a bit about chronic pain, and a lot of these people who show these GI system issues have had chronic pain or chronic back pain or something in their past. But one of these people that we've interviewed coming up are his parents. He's only a 14-year-old kid. Yeah, so how can he have such back problems?
Yeah, and I'm glad you brought that up, because that actually pairs well with what you talked about, where we've changed our positioning, right? And I think we mentioned this in a different podcast, when we're talking about athletics, but our kids now, when we were younger, I was riding my bike or walking to a friend's house to go pick them up, to go pick up another friend, to go play something, right?
Yeah.
And you came in once dinner was called or once it started getting dark out.
Yep.
We went from active to sitting. Now kids go from very inactive, okay? Either they're sitting, they're on their phones, they're on their tablets, they're watching TV, or they're playing video games. And I don't want to be too hyperbolic about it, but let's say that's 80, 90%. Right, of kids out there have maybe too much exposure to some or all of those.
Yeah.
And then you take them, and now you're putting them in club sport or travel league or whatever. And so now you're going from, nobody just plays recreational anymore.
It's one extreme to the other.
It's one extreme to the other. You are sedentary, not doing anything, or you're competing at a high level.
Yeah.
So I think we've set kids up for failure that way. And again, when certain areas of the spine fail, then you get symptoms. And I am seeing kids younger and younger, more and more common, having these symptoms. I treated a football lineman who, if you think about it, linemen are known to get something called spondylolisthesis. It's a slipping forward of one vertebrae on another. It's because they get too extended over and over and over again. If you picture gymnasts or cheerleaders or volleyball players or sprinters, a lot of people that get their lower back extended a lot, right? So gymnasts specifically are one of the highest incidents of spondylolisthesis. Anyway, so this kid was having a bunch of problems, and he had to get a special note that he was in a high schooler. I think he was 17. That he could go to the bathroom whenever he wanted, and his brother was making a joke that he had very rancid flatulence.
Okay.
Right. And he was actually here seeing me for back pain.
Yeah.
So he wasn't seeing me for any of the GI issues, and I kind of told him on the first visit, I'm like, hey, it's possible that those symptoms change over time. And with this treatment, and he gave me a pretty incredulous look, and 17-year-old guy, so just kind of huffed it off.
Yeah.
And he walked up to me maybe about 5-6 weeks later, and he said, hey, by the way, I wanted to let you know, everything had normalized. And the kind person I am, I said, told you so, and threw it in his face.
Yeah, of course.
I'm like, you didn't believe me, But I was very, very happy for him. But again, think about being 17 and having to rush off to the bathroom in the middle of class.
Yeah, it's embarrassing.
That's embarrassing,
yeah,
right?
rough.
Yeah.
impactful to your life for sure, stuff like that.
Yeah. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
What do you say to the people who, because I know people like this, they've been diagnosed with Crohn's 10 years ago, 5 years ago, whatever, and their life is these biologics and dealing with Crohn's flare-ups and constantly shifting their diets and whatever, but it seems like the treatments they're getting really aren't treating anything.
They're just managing their symptoms. So the steroids, obviously have an anti-inflammatory effect, right? And then the biologics, same thing, mostly. But nothing is treating the underlying cause because we don't know the underlying cause of Crohn's or ulcerative colitis. Look it up. I mean, ChatGPT, Google it, whatever. If you ask it enough questions to trying to get to the actual root cause, you're not going to find it.
Okay. So if you're one of those people, though, and you've been dealing with this for so long, is there still a chance for them that potentially it was a misdiagnosed back problem, and if they treat it, would it help them?
Yeah, absolutely. I mean, the longer you have it, most of the time, the harder it is to treat. But so one patient that we interviewed recently, Joe, do you remember? Did his podcast already came out, right?
Joe's already came out, yeah.
Do you remember when it came out, like 2-3 weeks ago?
It was a couple weeks ago.
So he had symptoms for 20 years. He had been on biologics for a long time. He had also had bowel resection surgery.
So he's exactly who I'm talking about.
Right, he's exactly who you're talking about. Somebody that it's been over 2 decades. He's been treated with multiple biologics, steroids, and they've had various effects, but still nothing really truly treating his symptoms. He's going to the bathroom multiple times a day. He had surgery to remove part of his intestines, his colon, and he's still having symptoms. And despite all that, when we actually treated the underlying cause, his symptoms dramatically improved.
With any of these people, is there any symptoms that you see that aren't typically associated with Crohn's or also?
Yeah, so, and this is what I try to do when I screen patients who, do a consult with me or whatever, right? I try to look for some of these symptoms that would point me towards meaning that it's more a spine issue and not an underlying inflammatory biologic issue, right? And there's a good amount of them. One of them being a history of back pain, right? Like, so if they had a history of back pain, or maybe their back pain, a lot of people say my back pain comes on when my GI flares, and you're like, no, it's the opposite. Like when your back flares, your GI gets worse.
That makes sense. Yeah, okay. I can see the,
people that didn't really respond well to the typical medications, and to be fair, that's most of the people, specifically most of the people that see me, because why see me if the medication's working, right? Then we're looking for other orthopedic symptoms, and they have a weird kind of cluster similarity of symptoms. Most of them at some point have had some form of leg symptom. Most of the time it's the groin, hip issues, a lot of knee issues on the same side as the groin, or feet issues that get diagnosed as plantar fasciitis, right? But then I'm also looking for people that aren't responding to changing their diet. I'm looking for people that I start asking them about different situations, walking, standing, being active, lying down. Does that bother your symptoms? Does that bring on any of these orthopedic symptoms? Does it bring on or change any of your GI symptoms? If positions do, if they change it, then I start to think more it's a spine issue, right? It wouldn't make sense that an inflammatory issue is worse when you're sitting upright on a bouncy bus, right? Shouldn't change it. No. So if it does, and so if I have some of these findings, now I'm more likely to think it's a spine issue, and I'm gonna try treatment.
I could also see that these medications that get prescribed, these anti-inflammatory medications, they are probably effective at first, right?
It's kind of a mixed bag.
Oh, okay.
I've had anybody from where they've been really well affected by the medication, majority of their symptoms, but they want to see if they can get off of it. to people that it's been up and down. At first it worked, then it stopped, and they had to, and I'd say this is more the norm. At first it worked, then it stopped, and they upped the dosage. That worked for a little while, but then it didn't work. So then they were told that their body was quote unquote rejecting it, and they had to go off, and then they switched to a new biologic. And then it was that again, or then that's when they started finding me.
And that would be one thing if, okay, this works for a while, then I have to switch to another one, that'll work, and then you could in theory live with that if it wasn't for such the harsh side effects, the potential. Well, and I mean, just look at like Bob's story that's coming up.
Sure.
The side effect for that was
cancer.
Possibly.
Right?
Yeah. I mean, the drug itself warns that there's a potential for that.
Sure.
So like that's not something we're making up. Do you know what I mean?
Yeah. Well, and additionally, I haven't really met too many people that say, hey, 100% of my symptoms are controlled with this medication.
Right.
So even with this strong medication that has a lot of side effects, and we're not even including monetarily, right?
Yeah.
I really haven't met anybody that says that, hey, this is the answer, this has solved it. Most of the time it dampens it a little bit, it takes the edge off, it maybe helps 25%, 30%, something like that. But my symptoms are still there. Symptoms
are still there, and it's not like you're back to your old lifestyle. You're not eating whatever you want. And
Right. My symptoms are still there, and I'm still trying to manage it with diet and exercise and lifestyle changes, and I still have symptoms.
Right.
Yeah.
So, all right. So, what do you say to those people out there who have been dealing with that stuff, not seeing the relief that they want, or are interested in trying something just with their back to see if it has any effect? And one, who can you recommend to do that? And two, if they start doing that, how long before they should see some sort of change?
All right, so
know if it's working.
Yeah, so how long before you should see some change? I look for orthopedic changes in the first week or two.
Okay.
Right, so if we're treating the back, I expect if they're having leg symptoms, hip symptoms, knee, foot and ankle, I expect to see some changes in those relatively quickly.
Okay.
With the GI issues, if you're having pain, pain going to the bathroom, or pain after eating or something, I expect those symptoms to improve within those first 2 weeks too.
Okay.
The frequency, the form of the bowel movement and stuff like that, I expect that to change maybe week 3, week 4, at the very least. I hope to see a change sooner, but I try to set reasonable expectations. And I think like by week 3, week 4, if you're not seeing the changes and you've been consistent with these exercises, movements, then it's probably not your spine. But you have to be consistent over the course of about 3-4 weeks in order to be able to say that. I'd say a lot of the patients, so the young man we talked about in a different country, Joe, who we just talked about, the Bob, who is in an upcoming podcast, all of them had symptom changes within the first week, if not the first few days of their bowel movements.
Wow. What if you're one of these people and you're like, well, I want to try that, but I'm on Humira or I'm on something. Should I go off that? Because I'd be afraid to drastically change.
That's a good question. I'm a big fan of minimizing variables when we first do something, because we need to know that it's what we're doing is making the change. So if you both stop your medication and start doing these exercises, if you're better or you're worse, we don't know why. So for the most part, I tell people to continue doing what they have been doing unless there's a medical reason. So for Bob, he had to get radiation therapy, so he had to come off of his medication.
Yeah.
But for most people, if you've been on, let's say, Humira once a month for the last 5 years, great, keep doing that. Because if you stop, if you're better, you're worse, you're the same, we don't know why. Now, if we're 5-8 weeks down into this treatment and you're not really having any symptoms, now start thinking, all right, now maybe I can come off this medication. Yeah, fine. That's a discussion to have with your doctor. That's a discussion to have based on the specific medication and your symptoms, but now you can start having that discussion. But at the beginning, I even make a joke with most patients. I'm like, I don't want you to change your mattress. I don't want you to start a new walking regimen. I don't want you to change jobs. As much as you can for the first few weeks working with me, try not to make anything different in your life, because we want to know the effects of what we're doing. You want to be able to look at it and say it was absolutely this, or I tried this and it didn't work.
So that was one of my questions.
Who to see is annoying because I don't know anybody else that does this. I really don't. And I'm trying to get this information out there. I'm working on treatment books. The GI one's probably like second or third in the queue, right?
We have some case studies in the works.
We're working on publishing some case studies and stuff like that. But beyond, I know there are some chiropractors out there that advertise treating GI issues. I don't necessarily agree with the way they do it, though. So
yeah, it's a.
And I don't want to say "see me" because it seems self-serving, right?
It sounds self-serving, but if you are out there, we do have some free videos and stuff you can find in our TikTok and our YouTube that do kind of touch on this subject. That'll give you some things to try. But obviously, I feel like if you're out there and you've been suffering for years, it's not seeing the relief. It maybe is worth.
I will admit, I do get a little gatekeeping with this specifically, because I've seen it work. It's a different way of thinking about it. It's relatively new, I've been doing this for about 5 years with this mindset, right? I've seen it work time and time again for a bunch of different people, ages, genders, chronicity of symptoms. But I'm afraid of people applying it and it not being successful because they're not applying it right.
Yeah.
And then if that's the case, then I can't get this off the ground. You know what I mean? I need some tailwinds with this. I need to make sure people are doing it right. I need to make sure we're troubleshooting it. I need to make sure there wasn't something else that was going wrong. So I do get a little bit gatekeeping with this treatment, at least right now.
Yeah. And, we have the people we've treated that we are, tracking, keeping touch with, updates with over the course of time to make sure it's working still. It's not something we just treat somebody with, they got better, and we never hear from them again.
Right. And that's the other thing. You need these people at least followed over the course of ideally a decade, right?
Yeah.
And right now we only have about 5 years of information for only a handful of people for that long of a time. But
it is very inspiring when you see someone who's been dealing with something for 20 years and to finally get some relief.
It's cool, and a little bit, or a large part of me, I'm proud that I can treat something in a different way that has that big of an effect on a person's life.
Yeah, as you should be. So Crohn's, ulcerative colitis. We have a couple interviews coming up in the next few weeks, so you don't have to hear it just from you or I.
Again, I don't expect anybody out there to see a TikTok or an Instagram of somebody talking about treating their back, their spine, a nerve issue to treat your GI, and somebody to just believe it, right? I wouldn't believe new information unless I talked to the person, unless I researched it, unless I thought about the rationale behind it, unless I heard some success stories from people that I can trust. So I'm very, I don't want to say distrusting, but cautious at the very least. So I understand when other people are, but hearing it from patients themselves,
I mean, if you're out there, I would recommend you check out the interviews we've done with patients. We also have a long form kind of mini doc on you talking about Crohn's, so they can understand more a deeper explanation of your treatment and philosophy on that. There's so much out there. It's for free, so go check that out.
Pretty much all of it, at least in regards to Crohn's, is all of that's for free, right? We haven't put a paid for series up yet. We'll work on it. But long story short, for the most part, it's somewhere around that TL junction for the most people. So it's like the upper back or upper lower back. I don't know how to describe it. A little bit below the chest bone.
Okay.
And that area tends to be stuck in extension. So especially a lot of women who have had children, because for 6 months or so they're stuck in extension. Their abdominal wall is lengthened and weakened. The back muscles, tendons, fascia, ligaments, joint capsules are shortened and stiffened.
Because they're compensating for that, or what?
Because they're stuck. Because they're literally arched. They're progressively arched over the course of this pregnancy.
Yeah.
A lot of women, I'd say, the majority of women have multiple pregnancies. You talk about 6 months, plus afterwards not having the ability or the knowledge to get yourself out of that position, right? We talk about a lot of runners, sprinters, gymnasts, volleyball players, dancers, linemen that are chronically or hyperextended, like why that area could. Then it could be trauma, a fall, stuff like that. Anyway, long story short, that area tends to respond really well to flexion, to moving it. With the modified Jefferson curl that we show a lot on our channel is typically the movement that I start with these patients. So I'm trying to give some guidance. Something to start here. I'd say if you're at home, if you're medically able to do that, if you start doing it and you give it 2 weeks of doing it about twice a day and a little bit throughout the day. So 2 real good sets a day, 1 in the morning, 1 later on, and then do a little bit throughout the day. If you do that for 2 weeks and you see a change in your GI, then you can be pretty confident that it's coming from your back.
There you go.
Was that helpful?
I think so.
Maybe we should do a short video like that.
Yeah, we can do a short video. I'll also try and pin, if we do a short video, we can try and pin a link in the comments here for this
Well, there
podcast.
You go. Wouldn't that be
really
helpful?
Help everyone.
Right?
You're welcome.
You know what, and beyond that, if you have questions, if you're trying to understand this process more, if you have questions, you have a bunch of options. You can reach out to us through TikTok and Instagram or YouTube. You can schedule a consult with me via our website, thespinaltruth.com. I'll go over your symptoms. I'll answer all your specific personal questions. I'll help guide you as best as I can, or I'll tell you what I can do for you, and you can sign up for treatment. So.
Make sure you check out these next upcoming podcasts with the interviews of
or the ones we did in the past too.
Or the ones we did in the past.
Yeah. All right. Well, that's our show. Hopefully you learned something. Hopefully we're helping you look at your body and your symptoms in a little bit different of a light, because that's what I found in my 17-year career in the medical industry. And make sure to like and follow our page and stay tuned for next week.